Have you ever considered seeing a physical therapist as often as your dentist or eye doctor? Today, we are here to explore the benefits of including physical therapists on your primary care team. My fellow classmates and I are current physical therapy students at Hardin-Simmons University, and we are here to inform you about the role of physical therapy in your primary care. But first, let us give you some background on the roles of physical therapists in your community. As physical therapists, we will be equipped with a doctoral level education and provide a unique perspective on movement systems, locomotion, and mobility. We are able to treat and rehabilitate patients in a way that promotes the development of fitness and wellness-oriented programs for a healthier and more active lifestyle, while also preventing the loss of mobility before it ever occurs. With the current structuring of our healthcare system, physical therapists are not regarded as primary care providers. There, however, is a shortage of primary care providers in the United States right now, which limits a patient's ability to receive adequate treatment in a timely manner. Since quality of care has always been a fundamental goal for healthcare providers, including physical therapists on the primary team will reestablish the quality of care that is expected.
Primary care providers are the first line of healthcare professionals. A few examples of professionals that are currently recognized as primary care providers are medical doctors, optometrists, dentists, nurse practitioners, and physician assistants. Primary care can be defined as an essential health care that is made universally accessible to individuals and families. It is a crucial part of the country's healthcare system. Thus, it should be provided at a cost that is affordable to the surrounding community. Primary care is the first level of contact for healthcare and is the first element of continuing healthcare process. Currently, physical therapists are fighting for unrestricted direct access across all states, which would allow patients to see a physical therapist without a physician's referral. Once direct access is obtained, the primary care team would greatly benefit from the addition of a physical therapist. Adding a physical therapist to this team will allow physical therapists to do yearly examinations on patients and be a more integral part of diagnosis and treatment plans. This can greatly benefit children by allowing early diagnosis of motor or developmental disorders and elderly who may be in need of physical therapy to prevent falls and maintain general strength. Also, physical therapists can prevent and detect injuries in young athletes during a routine checkup.
Physical therapists are able to obtain vital signs, perform range of motion tests, take a lead role in fall prevention, and prescribe necessary medical interventions to improve physical impairments associated with injury and disease. By establishing PTs as part of the primary healthcare team, we can combat the decline of primary care physicians to keep up with the increased healthcare demands as patients can be seen faster, diagnosed sooner, and can receive more care in a more efficient manner than in the current system we have today. Currently, this model has already proven successful in the military, which allows physical therapists to practice more autonomously and in close collaboration with other military healthcare professionals. Military physical therapists can order diagnostic imaging, lab studies, and are highly integrated in the primary care of military personnel. In Canada and several other countries in Europe, this model has already been adopted as physical therapists are serving among primary care providers, alleviating the burdens and workloads of other healthcare professionals. Other beneficial results of physical therapy can be seen in other manners, such as in the emergency room.
According to a recent study from Australia, physical therapists serving as primary patient contacts in emergency departments reduced patient length of stay and decreased use of imaging, all without an increase in adverse events. Additionally, the study found that approximately 13% of all people presenting to the emergency room had diagnoses suitable to be addressed and treated by a physical therapist alone. In regards to time spent in the emergency room, the patients being treated by a physical therapist spent 83 fewer minutes in the emergency room than the patients seen by usual medical staff. Physical therapists also ordered fewer x-rays, CT scans, and ultrasounds than the other providers. This shows that physical therapists are fully capable of being integrated into the primary care team, which adds benefits to the patient without significantly increase the cost associated with healthcare provision. Granting physical therapists the ability to act as primary care providers allows us to expand our reach within our community when we start practicing because of the easier access to a patient population that is seeking our services. Because of this access, we as physical therapists have the chance to use our expertise in a manner that can reduce the burdens associated with illnesses and other potential health problems. Having the opportunity to provide regular visits with patients can lead to injury prevention, earlier diagnoses, quicker interventions, and can have a greater impact, all without increasing the cost of healthcare. By including physical therapists on the primary care team, I believe that we can fully use our doctoral degrees to impact the community by reaching as many patients as possible in order to maximize functionality, mobility, and the quality of life.